Hello, everyone. We have another impromptu interview with Gritty Nurses, does ICN. And this is actually a really interesting topic because we don't think about the environment and nurses, but it's actually really important. So, without further ado, can you introduce yourself?
Certainly can. My name is Alysha Jones. I am a registered nurse. I'm a community health nurse and a nurse educator. I live in the territory of the Sauk and Chiano First Nations in Sauk, British Columbia. And I am a part of the Canadian Association of Nurses for the Environment. I am a co-chair of the Environmental Justice and Reconciliation Committee. So at CANE, we are all about health, justice, and the environment. So this is linking human health to the health of ecosystems, to the health of the water, the air, the food we breathe, and of course, the food we breathe, the food we eat, and of course, the equity and justice dimensions of environmental degradation, of climate change, and those obviously profound and accelerating and increasingly clear links to human health. So that's what we're really interested in. Advocacy, policy change, policy strengthening in Canada, that being the Canadian Environmental Protection Act, and enhancing climate change policy, linking for government, climate change and health, which is being done obviously. But we think nurses have a strong role in this, community health nurses, hospital-based nurses, nurses across the board. And so we're also really focusing on education and mentorship.
Yeah, that's amazing. I think, and it's so timely, right? I think we're seeing everything that's happening around us, and there are, like, we talk about politics all the time. We're seeing even political leaders not even won't even say that there's a climate emergency or a crisis. Mm-hmm. So I think this is such a timely conversation that we're having, and I think that it's important to highlight nurses that are in this space. So we're super proud and excited to talk to you. But I'll pass it to Sarah if she has another question.
So I think it's really interesting to talk more about the intersection between the environment and healthcare, because I think a lot of people think that healthcare lives in this silo. And I like to talk about the intersection and how healthcare actually interacts with so many other different industries. And I'm just curious, how did you get interested in this sort of initiative with the environment? Was it something like a aha moment, or was it something gradually that started over time?
I think for me personally, I've been interested in environmental work, conservation, and animal welfare actually long before I became a nurse. And there's just a natural fit, whether it's the caretaking of the other than human world, or it's just a sense of that a clear connection between humans and nature, humans and the land. It's an obvious one, but we are, I think, across the board in our society, we are divided from nature. We are, health professions and societal institutions don't often include discourses about the other than human world, ecosystems, and nature, right? So there is there's a human nature dualism that makes its way throughout our society, and it's hard to sort of get over that hump, but I think we have to now. That the pressing crises and their social ecological crises that are intertwined are making it such that we need to accept our connection with nature and start to work to restore and prevent further harm. So I think this is really the purview of nurses. I really think nurses can be in this space more, climate change, environment, and planetary health space.
What more could nurses do? We're health. We say that we're advocates. We want to make sure that we're not just talking about it, but we actually can physically do something, or even whether it's talking to political leaders. What can nurses like myself and Sarah, or other nurses that might be listening, what can we do to be a part of this change?
Mm-hmm. It's a really good question, and some of my colleagues at CANE have been doing that research to find out, what are nurses' thoughts on what they can do, and often there's a sense of what we can do personally. Right. In terms of reducing impact, whether it's what we're eating, we're choosing a plant-based diet, or whether it's biking to work more, reducing consumption in all kinds of ways. But there's a challenge of knowing what to do professionally. How can we do this at work? So what are the environmentally responsible actions that can be taken in the hospital, for example? And so one of my colleagues her research looks at there needs to be a top-down and a bottom-up. So individual nurses taking responsibility, but also organizations, healthcare organizations taking responsibility to help nurses choose environmentally responsible options. So whether that's in infection control buying practices, that's green teams in the hospital, there's sort of a range of things there. In community, it's a little different because we're working in a different space. So whether that's, it's education about climate change and adaptation and mitigation for patients across the board. And I think all of this kind of work in nursing is starting to be developed and starting to grow. Nurses at Kane are some of those leaders in Canada, and Alliance of Nurses for Healthy Environments in the US are another group. But how do we put this practically into action? That is some of the challenge right now. So I'm working on a rapid review paper right now with a few nurses looking at creating a climate health assessment tool for perinatal families with an equity focus. So pregnant people, young babies up to 1 year old, and the family of this newborn baby, how are they differentially impacted or more vulnerable to climate change? Extreme heat, air pollution, the challenges of potential evacuation, and what if that is a family that lives with a low income, is an Indigenous family, a family of color, a newcomer family that's disproportionately impacted then again? How do nurses at the point of care assess and help support that family to adapt or to whatever is needed in that? Still a work in progress, so we're not quite sure what that looks like, but
Well, that's so inspiring that you are doing so much already. You're so passionate about the environment. How can nurses find you, or how can they learn more about Kane?
They can go to our website, Canadian Association of Nurses for the Environment. We have a number of different committees. We have an education committee. We have a communications committee, and then the Environmental Justice and Reconciliation Committee. We would love more help because we're purely volunteer right now at Kane, and that's not always easy.
Well, we're happy to spread the word, and thank you, Alysha, for coming on and doing this little interview at ICN with us today. Thanks so much.